Hi, my name is Dr. Susan Williford, and I'm here to talk to you about cervical cancer. Cervical cancer is highly curable when detected early. The cervix is the bottom of the uterus, and it dilates or enlarges to allow the baby to pass into the birth canal. The cervix is located at the top of the vagina and is examined by a gynecologist when the woman goes for her routine pap smear. If a suspicious area is found on pap smear, often the woman will be called back by her doctor for a biopsy. Most cervical cancer is squamous cell carcinoma. The most important risk factor for cervical cancer is the human papillomavirus. It has been talked about a lot in the media as it can cause up to 70% of cervical cancer. We are trying to vaccinate young boys and girls before they've had sexual activity, as once the human papillomavirus is in a patient, the vaccine is not effective. Most cervical cancer is asymptomatic, meaning the woman has no symptoms but presents to her doctor just for a routine exam. Symptoms of cervical cancer as it grows include pain during intercourse, pelvic pain, or spotting between periods. This needs to be brought to the attention of your doctor. After a diagnosis of cervical cancer is made, the patient is staged. This is done by a thorough pelvic exam, which sometimes has to be done under anesthesia with the woman asleep. The doctor may also order a CAT scan, MRI scan, or PET scan to help in the diagnosis. Sometimes a woman may need to have cystoscopy, which is where the doctor looks in the bladder, or a sigmoidoscopy, which is where the doctor looks in the rectum to make sure the tumor hasn't invaded these organs. Cervical cancer is staged from 0 to 4. Stage 0 cervical cancer means that the cancer has stayed in the cervix. Stage 1 means when it gets from the cervical lining into the lining of the uterus. Stage 2 cervical cancer gets into the upper part of the vagina. Stage 3 cervical cancer invades into the lower part of the vagina, the pelvis, or lymph nodes. And stage 4 cervical cancer means it is spread to the bladder, rectum, or other organs. Since most cervical cancer is diagnosed early, local procedures are used. One of them is conization, which removes a cone-shaped section of tissue. Another is called the LEAP procedure, which uses electrical wire to remove the cancerous cells. Another common one is a hysterectomy, which removes the entire uterus and cervix. If a woman still wishes to have children, sometimes they can just remove the cervix and leave the uterus and ovaries for childbearing. These are surgical techniques that are used to remove the cancer in early stages. Even now, we use lesser surgical procedures such as laparoscopic and robotic surgery, which causes less of an abdominal incision. Sometimes a woman will also need radiation therapy or high-dose X-ray to treat cervical cancer. This can be done with external beam radiation, where radiation comes up from a machine outside of the woman. Another way is to use brachytherapy, where an implant is actually inserted into the vagina and cervix to give radiation. Chemotherapy is usually reserved in cervical cancer for later stages of disease or for very high-risk disease. Side effects of treatments usually are limited to the pelvic area, including post-operative pain in the pelvis, sometimes constipation, diarrhea, or bladder irritation, and pain during sexual intercourse. In Important questions to ask your doctor are, what types of local therapy are available to me? What are the side effects of treatments? When is it safe for me to resume sexual activity? And what happens if I want to still have children? Be sure to keep an open dialogue with your physicians and nurses, as you are the most important part of our healthcare team.